Hello and welcome to Treatments of Abnormality. With me, Will.
And me, Sarah.
I am very much the brains of this outfit, and Sarah is very much the radio voice. Radio face, I think I said.
Yeah, it's a radio face.
I'm very sorry.
Radio voice is much nicer, so I was quite happy you made that mistake.
Okay. Right. We're
The
going to start
biological treatment.
with the biological treatment, and it separates into two treatments. And the first treatment separates into two sections, which is confusing. So we're doing biological treatments, drug treatments or chemotherapy, and the first treatment, which is
chemotherapy. The first treatment is anti-anxiety drugs, which are, I'm just going to say the shortened down version because it's very long and quite a scary word. The shortened down version is BZs.
or benzodiazepines.
Yes, that's a long word. Examples include Librium, Valium and Xanax. They are sedatives that overall produce a calming effect. They slow down the activity of the central nervous system by increasing the levels of the neurotransmitter GABA, because GABA slows down the nerve cell activity, causing body relaxation. They also decrease the activity of the neurotransmitter serotonin. High levels of serotonin are associated with high levels of anxiety, which I did say earlier.
Right. An evaluation for the drug treatment, the first drug treatment, which is obviously BZs and the anti-anxiety drugs.
Anxiety.
Antidepressant drugs. BZs have been effective in reducing feelings of anxiety and panic. They were found to be more effective than the placebo. They are also found that 60% of patients with a panic disorder remained free of panic whilst on medication. And they have almost immediate effects. However, they have little effect on treating most specific phobias. And BZs were not the magical solution, as they created dependence on the drug, sometimes for many years after the initial problem had been resolved. Nowadays, GPs restrict drugs to short courses of 4 weeks, I believe. Mm-hmm. Dependence also leads to physical withdrawal symptoms such as tremors, irritability and insomnia, which is not being able to sleep, being irritable and shaking like a leaf. One of the main problems is that they treat the symptoms rather than the cause. And statistics show that there is 90% relapse rate when BZ medication is ceased. And ceasing the drugs can lead to rebound anxiety which is even worse than the original anxiety that they experienced, which is obviously just annoying. Now, the second type of chemotherapy or drug treatment is
antidepressant drugs. They generally raise serotonin levels in the brain, and MAOIs, like Nardil, block the enzyme monoamine oxidase.
That wasn't slowly for your benefit, that was slowly
because I couldn't read it, yeah. And prevent the breakdown of noradrenaline and serotonin. The SSRIs, like Prozac, block an enzyme that removes serotonin, hence increasing the levels of serotonin.
So to recap, Sarah, MAOIs, Nardil, block enzyme, mono and blah, 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 and prevent the breakdown of noradrenaline and serotonin. SSRIs, like Prozac, block the enzyme that removes serotonin, hence increasing the levels of serotonin. Mm-hmm. Right, when you get your head around that, you can see the horrendousness, which is the evaluation for antidepressant drugs. In trials with placebos, MAOIs were found to be effective in reducing symptoms of severe depression in 65 to 75% of cases, compared with the 33% of placebos. MAOIs were found to have a toxic effect, though, if combined with another drug, with other drugs and certain foods or drinks that contained tyramine, such as some cheeses, caffeine, bananas, beers, nuts, yeast extracts. God, I sound like a terms and conditions person. Take this drug, but do not have cheeses, caffeine, bananas, beers, nuts, or yeast extracts. Side effects of the MAOIs include hypertension, convulsions, weight gain, hallucinations, and mania. Basically, you turn into a fat, hypertension, on high, manic SRRIs recently have been the target of a media frenzy because there are many there have been many reports of serious side effects, including preoccupation with violence and suicide. Other effects include nausea, anxiety, insomnia, diarrhea, sexual dysfunction. Doesn't sound very good, basically.
No.
Right, so that's the first thing. Drug treatments, chemotherapy, anti-anxiety, BZs, antidepressants, MAOIs, SRIs.
I don't like using the word chemotherapy. It reminds me of cancer.
It basically is. That's what it is. That's kind of the point. It's what it is, drugs. So, second biological treatment is ECT, or...
Electroconvulsive therapy.
Go, Sarah.
Right. This means that you pass an electric current through the brain of 70 to 130 volts, which causes an epileptic seizure. The seizure is thought to improve a person's mood state. Newer procedures use strong muscle relaxant and anaesthetic given prior to the treatment, so it's a bit nicer for you, so don't hurt yourself. Electrodes are attached to the head and the current is passed through for about a second or less. This induces a seizure lasting no longer than 2 minutes. The patients regain consciousness about 15 minutes later and have no memory of the events immediately prior to the treatment. This is done 2 to 3 times a week for 1 to 4 weeks and may be repeated if the patient has a relapse.
Which is?
Which is what?
What's a relapse?
When you go back into
Same
your
state as you
depressed state.
ECT is a controversial treatment because no one knows how it works. It's been successful in treating severe depression in patients where all other methods have failed, and it can lead to permanent recovery in some patients. It is a quick form of treatment in contrast to drugs or psychological therapies, and studies indicate that 60 to 70% of patients improve with ECT, although a large proportion of these become depressed again in the following year. ECT should only be administered if antidepressant drugs have failed, although if it has been found that the relapse rate is high if it is followed by the same ineffective drugs. Side effects are reduced, although there is still memory loss. Although techniques are improving, there continues to be a decline in the use of ECT because of 3 reasons. Reason number 1, applying an electrical current to the brain is frightening and a forceful form of intervention. And even with the newer techniques, there are still side effects. Secondly, ECT has a history of abuse, being used as a means of punishing or controlling people in mental hospitals. And thirdly, effective antidepressant drugs now provide an attractive alternative. Lovely.
Ooh.
Oh, God. Next thing is the...
Behavioural treatment.
And the treatment is...
Systematic desensitization.
Which Sarah will now go through.
Right. The individual initially constructs an anxiety hierarchy, which...
Keyword!
Yes. Which is a series of scenes or events rated from highest to lowest in terms of the amount of anxiety they cause. Once the hierarchy has been constructed, relaxation training is given, which aims to achieve complete relaxation, and the essential task being to respond quickly to suggestions to feel relaxed and peaceful.
Yeah.
Yes. When the person is asked to imagine as vividly as possible the scene at the bottom of the hierarchy.
Spider!
Yes. And is simultaneously told to remain calm and relaxed. If successful, they can move up the scale, which is called graded pairing.
Keyword!
Another approach is to use graded pairing of the real stimulus, gradually approaching a real spider. Spider.
That's the example. Oh, spider!
Yeah, that's the example. This almost always is more effective and longer lasting than the imagined technique.
So basically, if you gradually do it like seeing a picture of a spider, holding a picture of a spider, seeing a spider up, a real one, holding a real spider, it's more effective than thinking about it, which makes sense, doesn't it, Sarah?
Mm-hmm.
I'm glad you agree. The evaluation for this is quite easy to remember. Basically, the patient is control, has a high success rate of 75% with simple phobias such as birds and frogs. Who's scared of a frog?
I don't know.
Who's scared of a frog?
Someone, don't be mean.
See a Freddo and go, ah! In blood injection phobias, reports say that there is a 90% success rate after 5 sessions of graded exposure. Keyword. There we go. It is also useful with OCD, although less successful with 50%.
Keyword.
key statistic.
Statistic.
Statisticals. It can usefully be transferred to other situations with relaxation techniques. Some argue that behaviourist techniques are not dealing with the causes, only with the symptoms, not dealing with what they were associated with in the first place. For example, you could be scared of spiders and solve your problem of being scared of spiders, but that doesn't solve the problem that you are, in fact, going to die because you got bitten by a spider and you are poisoned and turning into Spider-Man.
That's slightly off the point, but I see where you're coming from.
And the last point is that it does not always generalise to another real life. It doesn't always generalise to real life, basically.
Someone is going to write about Spider-Man in their exam now.
It's going to be Adam.
Adam.
It will be Adam.
That's mean.
He loves Batman.
It's Batman he likes.
Oh, God, the shame. Psychoanalysis, the psychodynamic treatment. We finished behavioural treatment now. And on to the psychodynamic treatment, which is...
Psychoanalysis.
Right, you do the first side, I'll do the next side.
Right, the aim is to uncover unconscious conflicts and anxieties that have origins in their past and bring repressed material into conscious awareness, thus gaining insight into the cause of the psychological disturbance. The client is encouraged to work through their hidden anxieties and conflicts by examining them in the safety of the consulting room. And doing this, so release the power I got the power. Sorry, I just had to do that. They exert over the behaviour. An important aspect of this is that confusing or traumatic childhood experiences can be better understood with the benefit of adult knowledge. Gaining insight is a time-consuming process. People normally have one or more 50-minute sessions a week, often for several years.
Now, psychoanalysis is split down into 4 techniques. I'm going to do the first one, because technique 1 is free association. Clients are asked to say whatever comes into their mind. They are asked to carry on talking, and they must not censor what they say. This free way of talking allows the unconscious mind to be assessed. Therapists can intervene to probe association and ask clients to develop particular points, and resistance occurs when freer association no longer flows freely. Froze freely? God, I can't even say that.
Talking too long.
The causes of these are the very thoughts that the therapists want to uncover, and the therapists often point out resistance to the clients in an attempt to overcome it. Most clients find free association difficult, and it usually takes some time before they can give a resistance-free account, apart from Sarah, because she just talks and talks and talks and talks and talks and talks and...
Talks.
Yeah, and so basically you can do the second technique, which is, of course...
Technique 2, word association. Keyword. The client is read a list of words, one at a time, and asked to reply with whatever comes instantly to mind. Examples of word may include mother. What comes to mind?
Cat.
Dark.
Rabbit.
Child.
Yellow.
Death.
Trolley.
He's slightly mad, as you can tell.
Lovely. Carry on.
The analyst pays particular attention to unusual responses, hesitations and mental blanks, which may indicate repression.
Repression, right. Technique 3 is dream analysis. Freud believed that our unconscious drives are expressed uncensored in dreams. However, they are disguised in symbolic form in order to protect the conscious mind. The role of the analyst is to help the client interpret the significance of their dreams. Which is lovely.
Woo. Technique 4, projective test. The most well-known are the ink blot and the thematic I don't know what that word is.
The most well-known are the ink blot and the thematic apperception. You probably know what it is. So stop laughing.
Apperception test. Yeah. The client is asked to describe what they see in the ink blot or to tell a story around the picture. They are used to uncover recurrent themes that may reveal unconscious drives. Denying an interpretation, that's why I can't read that word, denying an interpretation may indicate that it was correct, as it may have been rejected because it was too painful or threatening for the client to accept.
Yeah.
I can't read anymore.
Psychoanalysis. Oh, so much evaluation for this. Basically, the first bit of evaluation is it attempts to find the root cause of the abnormality, unlike other treatments which are criticised for treating the symptoms rather than the causes. It was popular in its time, and there were far fewer physical risks than with invasive biological therapies such as psychosurgery or ECT. It has been claimed that it doesn't work. However, for example, 66% of the control group improved spontaneously, whereas in the study only 44% of those receiving the therapy did, so apparently it makes you worse. By selecting different outcome criteria, improvement in the psychoanalysis group increased to 83% and the control group dropped to 30% in a later study. The therapy is criticised for being unscientific and untestable, as it... Untestable? Did I just say untesticle?
Sounded like it, but I don't think you did actually say it.
As it takes too many years for variables to be controlled. Because it is long-term, treatment is very expensive and is not widely available on the NHS. The therapies rely largely on interpretation of the therapist and thus is open to bias. The therapies also rely on the patient's recollections of events that occurred long ago in the past, so may be unreliable. The therapies may lead to friction within the families of the patients because they're basically blaming them. Recovered memories of child abuse that arise in therapy have caused much debate to whether they are real memories or false memories put in the mind by the therapy itself. And if the memories are false, then there is concern over the patients being falsely accused, and due to the attention that the false memories have received, there is danger that people who recovered genuine memories are not believed, which is very sad. And a further issue is the suggestion that unscrupulous therapists induce false memories for financial gain because the therapy will take longer, which I'm sure no one does that. But they probably do. And now is for the last bit of this unit.
Yay.
The cognitive treatment, known as...
Rational Emotive Behaviour Therapy, or REBT.
You can do the lovely explanation key features thing.
In Ellis's ABC model, activating events, A, or obstacles, leads to beliefs, B, about those events which may be rational or irrational. These in turn lead to emotional and behavioural consequences. C. The nature of the beliefs determine the nature of the consequences. According to REBT, beliefs are the main influence behind our emotional well-being. Irrational beliefs, experienced as self-defeating thoughts, are disruptive and lead to unproductive outcomes.
Because it's not activating events that cause unproductive consequences, REBT focuses on the self-defeating beliefs that accompany them. The client is encouraged to dispute these beliefs with 3 types of disputing.
Logical disputing, which is self-defeating beliefs do not follow logically from the information available. Empirical disputing, self-defeating beliefs may not be consistent with reality. And last but not least, pragmatic disputing, the lack of usefulness of self-defeating beliefs. Effective disputing changes self-defeating beliefs into more rational ones. The individual can move from catastrophizing. I'll say it weirdly. Catastrophizing to more rational interpretations of events, which in turn helps them to feel better and eventually become more self-accepting.
And finally, the REBT evaluation. Ellis claimed that a 90% success rate for REBT, taking an average of 27 sessions to complete the treatment. In an analysis of other therapies, REBT had the second highest average success rate of 10 forms of therapy, second only to systematic desensitization. For major depression, REBT in conjunction with medication is more effective than the medication alone. In relation to OCD, REBT, God, there's so many initials. In relation to OCT, oh, for God. I said it right the first time. In relation to OCD, REBT has about the same efficiency as most behavioural treatments. The therapy has been useful in treating anxiety, anger, depression, and antisocial behaviour, but less effective with disorders such as anxiety. Patients play an active role in their therapy because they have to work to challenge their thought processes, unlike other therapies which can be done to the patients and are therefore passive. The main criticism is that some irrational beliefs are in fact more accurate than those of most people, a phenomenon known as depressive realism or the sad advisor effect. This implies that actually defining what constitutes as irrational beliefs could be the problem.
Cognitive therapies are cost-effective because they do not usually involve prolonged treatment. However, it focuses on symptoms rather than causes. It is less manipulative than other treatments because it provides clients with strategies for self-help. However, REBT is regarded as one of the most aggressive treatments and is also judgmental about the nature of the client's thoughts.
Now, if you have listened many times to these three recordings about the descriptions, about the definitions, the explanations and the treatments of abnormality, then you will get an A on your exam.
Hopefully.
You will.
Yes, you
Positive
will.
thinking.
You will.
Positive thinking.
Positive thinking.
And with that, me Will.
And me, Sarah.
I leave you be. Good night, morning, or afternoon, or day. And, yeah. Thank you for listening. Bye.